Welcome to Career Journeys, a series of videos by the Consortium for Public Education. Here we explore the career experiences and pathways of professionals from a wide variety of careers to help you think about the skills you'll need and the paths you might take after high school.
I'm Austin Anderson, Business Development Officer for the Forum for Workforce Development, a collaborator with the Consortium for Public Education. Today, I'm interviewing Dr. Cole Wilder, a health sciences professional and my brother, as part of our Career Journeys video series to share insights into a professional's pivotal experiences and career pathways. Thanks for joining us, Dr. Cole Wilder.
Thank you for having me.
Tell me about your company and your role there. What do you do as a clinical assistant professor?
I work for the University of Texas at Tyler, and I am a pharmacist and an educator. So my role is to serve as a pharmacist in the community, particularly in the hospital setting, where I will work with students in their last year of pharmacy school, obtaining their intern hours they need to become practicing licensed pharmacists. And I also have a significant portion of my time, which is dedicated to instruction of the students in the classroom as well. So it's a hybrid model, but I do consider myself primarily a pharmacist first. So that is sort of what my role is here at the University of Texas at Tyler.
So did you always think you were going to be like a pharmacist or a professor?
As really a young child, I always had interest in education and teaching. The first thing I wanted to be when I was growing up was, as you know, a teacher. But I got really involved in the sciences, the basic sciences. So really interested in chemistry and biology in high school. And I knew I wanted to work in the health professions based on sort of what my desires were to help the community and get involved and be the best I could be for my community. So then it sort of developed from there to health professions. I thought about psychology, clinical psychology, and being a counselor for a time. I was really involved with an organization in high school called HOSA, which is Health and Occupational Students of America. And at that time, I got exposed to pharmacy. And I really liked pharmacy, particularly because of the significant integration that it had with chemistry and the understanding of the drugs and how the drugs work, with that aspect of being able to work as a person in the healthcare setting with patient care, particularly. So I decided to pursue pharmacy as a career. I completed a bachelor's degree in biochemistry, so I did have a good foundation in the chemistry before I went on to pharmacy school and completed my doctor of pharmacy degree. And then from there, I actually went on and did postgraduate residencies, which is specialized training for pharmacists. In the residency program, I was able to work with several students and do some one-on-one education and what we call precepting for those students who were, again, completing their final year of pharmacy school in order to get their licensure. And that really sort of reignited that passion that I had for teaching. So then my goal from there was to pursue an academic appointment where I could sort of have the best of both worlds. All of this is a culmination of all the things that I've wanted to do, and a really interesting amalgamation or a mashup of all the things that I've really enjoyed. And for me, I think it is sort of me living out my dream job.
Give me some of those few core skills that make you particularly good at your job.
Well, for me, and I think as all young professionals do, I still struggle with the being good at my job per se. I do enjoy what I do, but I think every day it's learning something new. And I think that's a healthy thing. And again, I think that's a benefit of pharmacy too, and all health professions is it's a lifelong learning commitment that we undertake. The most important thing is the flexibility that you have to have within the team setting. So healthcare has really evolved over the past 15 to 20 years, especially, to be more of a team-based approach. And I really enjoy the collaboration that takes place. So oftentimes it's not just a physician sort of mandating things anymore. I am very lucky within the hospital setting to work very closely with physicians and see these patients with physicians and contributing to their care directly by talking about appropriate drug therapy, minimizing the use of drugs, which can lead to side effects, adverse effects, things that the patients might experience, and really sort of what we call optimizing drug therapy, making sure that the drugs that we're using are appropriate and we're using for the appropriate length of time, and making sure that the physicians and patients are educated on the side effects that they experience and sort of what the outcomes are going to be. So I think the ability to work within a team and a desire to contribute to a team is one of the key things, particularly in my aspect of pharmacy practice.
What things can a student do in high school to help prepare for your career or a career in your field?
Pretty much in high school, if you have any interest at all in health professions, extracurricularly, there are really two things that you can do. And I think based on my experience and conversations I've had with other students who are sort of preparing for all professions, anything that you can do that is service related and demonstrates leadership. So leadership and service are the two sort of key elements. And I think that is going to be beneficial for all high school students, regardless of what career they pursue. And again, with the service and leadership, those can be community-based, they could be organizationally based, so working with organizations. There's all kinds of different service organizations out there, and I think involvement in that. I was very involved with Key Club in high school as well. So other service organizations. Strong academic performance is important for all health professions. You want to make sure that you have a good understanding of biology and chemistry, particularly if you want to go into the medical profession, being a physician or a pharmacist, or in the upper level nursing professions. I think an aptitude for chemistry and biology is beneficial, but even more important than an aptitude, I think, is an interest. So if you have an interest, sometimes the aptitude can follow with that. You're able to sort of work harder on those things that you find interesting and be able to develop those skills a little better. But academic performance is always important. So doing the best you can, the classes that you have. If you have an interest in chemistry and biology, some healthcare professions, maybe something to think about. And then extracurricularly, get involved in service organizations or even just doing your own community service. And then demonstrating some leadership skills or opportunities for leadership.
What's one last piece of advice you would give to anyone aspiring to be in your field or in your position?
Find something that you're passionate about that motivates you, and pursue that. So there's the old cliche saying about making your vocation your vacation, so to speak. But I think, again, particularly for me, and I've done a lot of different things in pharmacy. I've been very lucky to have a lot of experiences, but none of them have been bad experiences because I'm very passionate about what I do. And all the, even if it was not necessarily a good interaction or maybe some negative things about the aspects of practice that I've had, I've still taken those and utilized that information or utilized the experiences to sort of shape what I do now. So the key thing is finding your passion, find what you like to do. And then if you do that, even though you have to work really hard, it all makes it worthwhile. Find something you're passionate about, find something you love to do, particularly if there's a need, which again, in healthcare professions, if you're passionate about taking care of people, trying to make the world a better place, healthcare professions is wide open. There's several opportunities in several different aspects of healthcare. It's a lot of hard work. It's a lot of time. It's a lot of effort. It's a lot of money sometimes. But the financial incentives are there, but that can't be the reason you go into healthcare professions. It really has to be sort of the impact and the differences that you can make. And again, I think that all comes down to passion.
Thank you for sharing your experiences and your thoughts with us, Dr. Cole Wilder. Appreciate you.
Thank you, Austin.
For more information or to learn about other careers in the Career Journey series, visit our website and check back soon for our next installment. Thanks!